And an interesting fact about this medication is that it has more noradrenergic effects than antihistaminergic effects at higher doses. And what this means is that at higher doses, it functions more as an antidepressant, whereas lower doses, it's more sedating and often used for the treatment of insomnia. Welcome back, Straight Talkers. Today I'm going to talk about the medication Mirtazapine so that you can be better informed when deciding whether or not to start this medication. So Mirtazapine is the generic name and Remeron or Remeron Soltab are the brand names. So how does this medication work? On a basic level, it works by increasing the amount of neurotransmitters, serotonin and norepinephrine in certain parts of the brain. It also acts on histamine and alpha-2 adrenergic receptors. In adults, Mirtazapine is FDA approved for the treatment of major depressive disorder. It does not have an FDA approval for the use in kids. However, it's often used off-label and can treat several other conditions, including post-traumatic stress disorder, generalized anxiety disorder, panic disorder, insomnia, nausea, cyclic vomiting, and decreased appetite. So Mirtazapine comes in a tablet formulation. There's also a version where the tablet can be orally disintegrated, and it usually is only taken once per day by most people. The typical dose range for this medication is between 15 to 45 milligrams daily. Once the medication is started, it usually takes a couple weeks before you start noticing a difference, and in many people, it'll take a whole 1 to 2 months before it reaches its full effect at the prescribed dose. Now let's talk about potential side effects. But first, make sure you hit that subscribe button so that you can be the first to know when new content comes out. So the common but usually more mild side effects of Mirtazapine include somnolence, dry mouth, increased appetite, constipation, weight gain, lack of energy, dizziness, and flu-like symptoms. This medication has the benefit of not having any sexual side effects associated with it. In addition, given its propensity to cause sedation and weight gain, it's actually a good option for those who are struggling with depression, low weight, or poor appetite. The more serious but less common side effects can include increased suicidal thoughts or actions in those under the age of 25 years old, serotonin syndrome, decreased white blood cells, increased cholesterol or triglycerides, manic episodes, seizures, or low sodium levels in the blood. Research suggests that once someone's symptoms return to baseline and they're back to feeling normal, they should continue on the current dose of the medication for an additional 6 to 12 months. And what this does is it helps prevent relapse or recurrence of depressive symptoms. If Mirtazapine is being used to help with sleep, some people will only use this medication short term and more on an as-needed basis. Now head on over to the next one to find out more ways that you can help your child live their best life.